right, folks, we are back. It's the Alex Jones Show. I am Jason Bermas sitting in. Alex coming up in the second, third, and fourth hours. International Swine Flu Conference. All right, so this happened August 19th and 20th, and then the actual workshop where they role-played and set everybody up to get ready for what's coming in 1 month, 2 months, 3 months, 4 months, because, again, this is a 3-spot shot flu. It's not just one wave. They're already making it clear there's going to be 3 waves, and they kind of have to make it that way because after the initial inoculations, that's when you're actually going to see people get sick. After the kids take it and they inject them with, live bird flu, live H1N1, which is the pig flu virus, just like they did in the Czech Republic and 13 other countries in February. Remember, Baxter International sends out, quote-unquote, mixing agents, and they shoot up a ferret. The ferret doesn't make it, folks. And the guy's like, whoa, what's going on here? This isn't right. What's in this? Oh, my God, there's live viruses in this thing. He goes public. It gets printed in Bloomberg. There's one story on MSNBC, and silence. And then literally less than a month later, the pig flu shows up. And remember, it came from Mexico at first, and then it's not from Mexico. It's from Mexico, and then it's not from Mexico. And we've got all these pigs with it. Wait, we can't show you any pigs that actually have it. And then the first pig that they find is in Canada. In Canada, folks. And how do they explain that? They go, well, that pig in Canada, he'd been handled by a Mexican migrant worker. They don't name the Mexican migrant worker. They have no evidence whatsoever. They just said it. And they hyped up all these deaths in the United States from pig flu. When you looked at the initial deaths that they were reporting, none of them were from the pig flu virus, okay? Let's go through the first one. First one, a 2-year-old boy who had chronic illnesses since he was 2 months old, okay? In and out of hospitals all over in Mexico. He crosses the Texas border. He doesn't make it. Pig flu killed him. Total lie, total propaganda. Next person who dies from the pig flu. Somebody who was in the hospital because she was pregnant since mid-April, had all these other chronic illnesses. The baby makes it, she doesn't, pig flu. The next person who dies from pig flu is a principal out in New York City who had gout and a ton of health issues. No, he didn't die from gout or his other health issues, his other respiratory illnesses. No, pig flu. So I have to go through this because this is not a deadly virus. Listen, let's say you do get infected with this swine flu. Oh, no, the swine flu. I'm sorry. You might have some sniffles. You might need some chicken noodle soup, a couple glasses of Schweppes ginger ale, maybe a little ibuprofen for the pain. That's about it. No one's going to die from this thing. Okay, but that doesn't stop them from having these conferences and going over mass fatality management planning. Let me repeat that for you. Mass fatality management planning. If you're not on prisonplanet.tv right now, you really need to be. So what is this? Top leaders and key decision makers of major companies representing a broad range of industries will meet with distinguished scientists, public health officials, law enforcers, first responders, and other experts to discuss pandemic prevention, preparedness, response, and recovery. And this is the first International Swine Flu Summit. Who's behind it? Who is behind it, actually? Ha, 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 ha. WHO, UN-controlled propaganda. The United Nations Coordinator for Avian and Human Influenza, Alex Thurman of the World Health Organization, was the person who headed this up with Dr. Wening Zhang. All right, what will the topics include? Right at the top of the list, numero uno, mass fatality management planning. What does that mean? That means you get sick, you die, we got to find a way to get rid of your body. Okay? You're nothing. You get no funeral, you get no hurrah. You are part of the problem. You need to be burned up and forgotten about. That's what this is. Mass fatality management planning. And then another one is National Pandemic Influenza Medical Countermeasures. Now, under the concurrent breakout session of the Mass Fatality Management Planning, they have develop and implementing training and exercise programs. You have to make the people more docile. You have to get them acclimated. You have to get them used to seeing all these dead bodies of their friends, their family, their coworkers, their neighbors. Do you understand? You have to make them aware people are going to die, and you've got to help. Direct fatality management tactical operations. What are we going to do with these dead bodies? We got to ship them somewhere. We got to burn them somewhere. Maybe these mobile incinerators they're making will help out. Activate fatality management operations. So in other words, we're going to need the National Guard involved. We might need local police involved. We might need the UN and NATO involved. After all, this is an international issue. Folks, they've openly stated 4.9 billion vaccinations. 4.9 billion vaccinations for a populace of 6 billion people. Not many are going to slip through the cracks, okay? They are actually passing legislation. See, they know there's no law. They know international law, even though they've declared WHO level 6, okay, and you have no individual human rights under this. Okay, I don't have the document offhand, but I know it's somewhere here. It is the checklist for influenza pandemic preparedness planning. And in it, it openly states in subsection 1.5.1 that they will quarantine you, that they will make makeshift vaccination centers out of other buildings, that you have no individual human rights, that they are suspended. Now you say, well, we're not under international law. Well, some people would argue that we are, especially the globalists and the elite and people like Barack Obama and his administration. But they got another one for you. You see, if you don't want to go by international law, there's an executive order they can call out. 13375. All of a sudden, 1 year in prison, 250 G's. That's right. 1 year in prison, fine $250,000 for not taking the swine flu shot. What this is for is intimidation. They're intimidating you into doing, just take the shot, guys. Listen, you take the shot. No big deal. No prison sentence. No fine. Just do it. It's no big deal. Now they're trying to do it on local levels, where they're going state to state to state and saying that they can fine people $1,000 a day. So again, they try to do it at the state level. They are doing it at the federal level and then the international level. They keep climbing the ladder, but they're really reverse climbing it. See, they institute the top down mentality where they say, look at this authority, look at this authority, look at this authority. And if that authority doesn't work, they fall back on other authority. All right, let me continue with this document. They have to conduct morgue operations and manage anti-mortem data. Now here's the next section of this conference, psychological issues. What are we going to do with people who are unwilling to follow government orders? What are we going to do to the people that don't want to be rounded up? What are we going to do to the people that don't want to be quarantined? What are we going to do with the people that won't let their children go to school when they become mass vaccination centers? What do we do with those people? Well, we enact the continuity of government program. Continuity of government, what's that? That sounds like a big operation, Jason. Well, actually, folks, it's the shadow government. That's right. The shadow government is not just in James Bond movies. It's not just in action thrillers. It actually exists. It's been around for a while now. Its government name is the Continuity of Government Program, COG. And, we're going to have Peter Dale Scott up in Texas sometime next month. He's going to be interviewed for my film Invisible Empire. Again, we're going to play the trailer for that later. But we're going to be discussing the shadow government and COG. COG was in place on 9/11, folks. We're not that far away from the anniversary. I just want you to know there were drills using COG operations before the attacks. And then COG was mysteriously on the scene of the Pentagon as it got struck. And mysteriously, another plane that looked government, that looked COG, was on the scene of New York before the second plane struck the World Trade Center. Very odd. Part of Global Guardian, this mass Armageddon drill, okay? So anyway, here we go. Continuity of government operations. When H1N1 flu pandemic unfold in the next 2 or 3 successive waves of our calendar year, remember 2 or 3 successive years, how do we institute this program? And how do we get the public to go along with it? So what are we going to do with the first responders in the fire department? Well, we're going to figure out how they can effectively undertake mass vaccinations and enforce quarantines. You see? Enforce quarantines. That's why in Paris, Maine, they have these drills with the National Guard dressed up in full riot gear like a police state. Okay, they're not wearing... Listen, if the National Guard's there, no reason for them to be in bulletproof vests, in big, face helmets, in body armor, batons. No, they're the National Guard. They should be in regular military uniforms. No, these are militarized police uniforms, ending posse comitatus, all right? They're softening you up with the National Guard, but they're openly stating, and by they I mean the Pentagon, that 400,000 troops are going to be on the streets in the United States while this occurs. And you can bet it will be Army, Navy, and Marines. But they're softening you up with the National Guard because they know that's what you're used to. They have to figure out how law enforcement agencies will control and diffuse social unrest and public disorder. We've got to keep disorder at bay, folks. That's what we need to do. And isolate prisons and other facilities. They need to control traffic, evacuation, and mass transportation. You think you're leaving without taking that shot? No way, buddy. You're taking it or you ain't leaving the county.